Breast cancer is the most commonly diagnosed cancer in women globally. Every year, millions of women receive this diagnosis. Many of these cases are caught in the later stages. This often happens because a symptom was noticed, but the individual waited, hoping the change would simply reverse itself. The data shows a clear contrast in outcomes. Stage 1 breast cancer has a survival rate of over 90%. However, once the disease reaches stage 4, it becomes much harder to treat, and those survivor statistics drop. While factors like biology and healthcare access are complex, the interval between noticing a change and seeing a doctor is a variable within an individual's control. Reducing that window of time is a direct way to move toward those higher survival rates. To manage that timeline, the first step is visual. Stand in front of a mirror with arms at your side and raise both your arms. Now you are checking for macroscopic changes. Look for a shift in the overall outline of the breast, or if one side has become noticeably larger than it was before. Next, look at the skin surface. Watch for puckering, dumpling, or thickened texture that looks similar to an orange These visible external changes can act as an indicator of what is happening beneath the surface, often appearing before a lump has ever felt. The most common physical sign is a new lump or a thickening of the tissue. It is a mistake to assume a tumor must be painful to be dangerous. Cancerous lumps are mostly painless, which is why they are overlooked. This tissue cross-section shows the physical difference. Benign growth are often smooth and round, while a cancerous lump typically has an irregular jagged shape. Movement is another indicator. A harmless mass moves when pressed, but a concerning lump remains fixed, anchored to surrounding tissue. Monitor the nipples for changes as well. These include sudden inward inversion, skin rashes or crusting, or unexplained fluid discharge, especially if bloody or one-sided. The rule for a physical check is that any new persistent change deserves a medical evaluation. A self-examination must extend beyond the breast itself and into the armpits. This anatomical map shows the connection. The lymph node in the armpits are a primary pathway for spreading cells, meaning swelling in this area is often one of the first signs of breast cancer. If you find a lump or swelling in the armpit that lasts longer than 2 weeks, you need to see a doctor to perform a thorough check. Use the flat part of your finger in a circular motion once a month after your period. Move from the collarbone across to the armpit and towards the center. Knowing how the breast tissue connects to the underarm allows you to cover the specific areas where anomalies are most likely to appear. Increases with factors likely age, over 40, family history, and lifestyle habits such as regular alcohol consumption or obesity. After menopause, imaging can also be complicated by tissue density. On an X-ray, dense breast tissue appears opaque, which can visually hide a lump that has the same density. That is why clinical screenings like mammograms are necessary. Partners to the monthly checks you do at home. Mammograms can identify abnormalities before they are large enough to be detected by touch. Higher risk factors are not a diagnosis, they are an instruction to use screening technology to find changes before symptoms ever arrive. If you find a lump, a change in shape, or a discharge, see a doctor within 1 week. Do not wait to see if the symptoms go away. Share this timeline and these specific signs with the other women in your life. Using your hand and a mirror to monitor your own body ensures that if cancer is present, it is found at its most curable stage.